Good evening, I'm Richard Rogers.
And I'm Meredith Anderson. After a visit by drug enforcement agents, an Augusta doctor is putting some patients and prescriptions on hold.
Agents searching the clinic off Central Avenue say they became suspicious when a lot of prescriptions for Hydrocodone written by this doctor in question were filled at a Laney Walker pharmacy. News 12's George Lopez live in our newsroom with the latest. George.
Richard, within the last 20 minutes, the sheriff's office says they found a, quote, inordinate number of prescriptions for other pharmacies written by Dr. Achhinder Ohri. This is not the scene an insurance agent working next door to this doctor's office expected.
When I go outside and I see more agents and boxes and guns, I'm thinking, well, what's going to happen next? You know what I mean?
Today, drug enforcement agents searched the clinic off Central Avenue. The doctor in charge was not arrested, but an agent on scene did say he gave up his license to write strong prescriptions like hydrocodone.
Let's say if he didn't get here at 9 o'clock in the morning, you know, it wasn't abnormal for cars to be there 8:30, 8:45 in the morning sometimes, just waiting for them to open.
Dr. Ohri's door sign says he practices general medicine and patients don't even need to make an appointment.
This morning was a guy standing out there with his socks on. I mean, it's almost 30 degrees outside. You know, who just stands out in the parking lot like that?
Agents spent hours inside the clinic. They wouldn't say what they were looking for, just that they were acting on a tip and that this was an inspection, not a drug bust.
You know, it's kind of crazy. I mean, you come to your office to work and you see gentlemen come in asking questions and you find out they're a DEA agent. Well, I'm a smart enough guy to know what a DEA agent is and know what he's here to do.
Now, investigators also found other violations which led to Dr. Ohri giving up his medical license. We saw clear bags labeled as evidence with prescription bottles inside. Because of those items we asked an agent on scene if they suspected the clinic was a pill mill, and a pill mill being a place where people can get strong prescription drugs with few questions. We were told that was a possibility, but the investigation is still open, Richard.
So, George, we've got the DEA involved in this case. That means it's a federal case here. What charges could this doctor face?
Well, it's going to be a felony, and that charge could be improper distribution of prescription drugs. He could serve anywhere from 2 to 10 years in prison.
Thank you, George.